Have you ever thought about trying testosterone replacement therapy but stopped yourself because you weren't sure? Is it really worth it, and what are the actual risks? If that question has been sitting in the back of your mind, I want you to know you are not alone. Every single week, men walk into conversations with me carrying that exact uncertainty. And today, I'm going to give you the clearest, most honest answer I can, based on real clinical data, not fear, not hype, and not the kind of vague half-answers that leave you more confused than when you started. I'm Dr. Christine Rodriguez, and welcome back to the Men's Vitality Hub. This channel exists because men deserve complete, evidence-based information about their hormonal health, not a 10-second brush-off at a rushed appointment. Today we are covering everything. What testosterone replacement therapy actually does inside your body, the real benefits that research has documented, the risks that are genuine versus the ones that have been wildly exaggerated, and who actually belongs on this therapy and who doesn't. And I want to tell you right now, there is one risk associated with TRT that almost nobody talks about, one that could be quietly affecting your quality of sleep tonight. Stay with me all the way through because that one matters. Let's begin at the foundation because before we can talk about treatment, we need to understand the condition it treats. Testosterone replacement therapy is a medical intervention designed for men who have what we call hypogonadism. This is not simply feeling older. This is a clinical condition where your body is no longer producing adequate testosterone, confirmed by blood testing and accompanied by real, measurable symptoms. The blood level threshold most guidelines use is a morning testosterone below 300 nanograms per deciliter. And the morning timing matters because testosterone naturally peaks in the early hours and declines steadily through the day. Testing in the afternoon can produce falsely low readings that misrepresent your true hormonal status. But the number alone is never the whole story. A man can have a testosterone of 295 and feel completely functional. Another man can sit at 320 and feel like a shadow of himself. That's because hormonal health is not just about circulating levels, it's about how your cells respond to those levels, which depends on your androgen receptor sensitivity, your sex hormone-binding globulin, your overall metabolic health, and a dozen other individual variables. This is exactly why symptoms matter just as much as the lab value. The recognized symptoms of hypogonadism include persistent fatigue that sleep doesn't fix, reduced sex drive, difficulty achieving or maintaining erections, particularly morning erections, brain fog, mood changes including depression, loss of muscle mass despite consistent training, and a creeping increase in body fat especially around the midsection. If those symptoms sound familiar, and if your blood work confirms the low levels, that is when a serious conversation about TRT becomes not just reasonable, but medically appropriate. Hypogonadism becomes significantly more common after the age of 40, and the risk climbs higher in men who also carry other metabolic conditions. Diabetes, elevated blood pressure, high cholesterol, obesity. These conditions don't just coexist with low testosterone by coincidence. There is a genuine bidirectional relationship. Low testosterone worsens metabolic function and poor metabolic health suppresses testosterone production. It becomes a cycle that feeds itself, quietly accelerating unless something breaks the pattern. So, what does the research actually show about the benefits of TRT in men who genuinely need it? Let's look at one of the most important studies ever conducted on this question. In 2016, a landmark trial published in the New England Journal of Medicine enrolled 790 men aged 65 and older with confirmed low testosterone and followed them through 1 year of either testosterone gel or a placebo. The results were meaningful across multiple dimensions simultaneously. Men on testosterone showed significant improvements in sexual activity, sexual desire, and erectile function compared to the placebo group. But what made this trial particularly powerful was what it found beyond the bedroom. Men receiving testosterone were measurably more capable of physical function. They walked farther in a standard 6-minute walking test, with 20% of the testosterone group hitting a clinically significant improvement threshold versus only 12% of the placebo group. They reported better mood, lower rates of depressive symptoms, and significantly greater energy levels. For men who were struggling to move through their days with any sense of vitality, these were not small changes. They were genuinely transformative. Still with me? Good. Because the benefits go even deeper than most people realize. Beyond that landmark trial, a broader body of research has documented what sustained TRT does to body composition over time. Men who remain on therapy for 3 or more years show an average gain of nearly 4 pounds of lean muscle mass, and they lose an average of 6.5 pounds of fat mass compared to men not on therapy who showed minimal changes in either direction. More lean muscle means a higher resting metabolic rate, better insulin sensitivity, and improved glucose regulation. Less visceral fat means lower systemic inflammation, lower cardiovascular risk, and less aromatization, the process by which excess fat tissue converts your testosterone into estrogen, further suppressing your hormonal health. Research has also documented improvements in bone mineral density, particularly in the spine, which is critically important for men over 50 who face rising risk of osteoporotic fractures. The skeleton is a living, dynamic tissue that responds to hormonal signals, and testosterone is one of the primary signals that keeps bone-building activity engaged. Now let's address the risks carefully, because this is where the most dangerous misinformation lives. Some risks have been catastrophically overstated, others are real and deserve your full attention. The most persistent myth about TRT is that it causes heart disease. This fear traces back to a flawed 2013 study of veterans that received enormous media coverage and led to a wave of men abruptly stopping their therapy. The study's methodology was seriously criticized. It used complex statistical adjustments that actually reversed what the raw data showed. The men receiving testosterone in that study had fewer cardiovascular events in absolute numbers. The adjusted figures were what generated the alarming headlines. What happened next tells a much clearer story. A subsequent analysis of over 83,000 men in the same VA system found that men on TRT who achieved normal testosterone levels were 56% less likely to die during the follow-up period, 24% less likely to have a heart attack, and 36% less likely to have a stroke. And most recently, the TRAVERSE trial, a randomized controlled trial of over 5,000 men with existing cardiovascular risk factors followed for nearly 3 years, found no significant increase in major cardiovascular events between men on testosterone gel and those on placebo. The cardiovascular fear that dominated public conversation for nearly a decade is not supported by the current body of evidence when TRT is used appropriately for men who are genuinely deficient. Another persistent myth, that TRT worsens urinary symptoms and accelerates prostate trouble. Here is the key biological detail that changes everything. The androgen receptors in the prostate become saturated at relatively low testosterone concentrations. Once those receptors are full, adding more testosterone does not produce more prostate stimulation. There is no more receptor capacity to activate. A careful meta-analysis combining data from 14 randomized controlled trials involving over 4,000 men found no significant worsening of lower urinary tract symptom scores in men on TRT compared to placebo, and on prostate cancer specifically. A study following 150,000 men over 15 years found no statistically significant difference in overall survival or prostate cancer outcomes between men who had used TRT and those who had not. Now let's talk about the real risks, because they are real and you deserve to know them clearly. The risk I promised you at the start: sleep apnea. Research has shown that approximately 10% of men on TRT develop new or worsening sleep apnea compared to around 4% in placebo groups. If you already snore, if you have a larger neck circumference, if you wake feeling unrefreshed despite adequate hours of sleep, these are signals that you may already have sleep-disordered breathing. Starting TRT without addressing existing sleep apnea can worsen it, which in turn suppresses testosterone, disrupts deep sleep, raises cortisol, and creates a hormonal environment that works against everything you are trying to achieve. A sleep evaluation before beginning therapy is genuinely worth pursuing. Erythrocytosis, blood thickening through excess red blood cell production, is another real and monitored risk. TRT stimulates red blood cell production, which can become problematic if hematocrit climbs too high. Research shows an average hematocrit increase of about 3 percentage points on TRT. This rarely becomes dangerous with proper monitoring, but it is exactly why regular blood work throughout therapy is non-negotiable. Injectables carry a higher rate of this effect than gels or oral formulations. Fertility suppression is a risk that every man under 50 must understand before beginning TRT. When your body detects elevated testosterone from an external source, it reduces the internal signal that drives sperm production. Studies have shown that after 6 months of TRT, approximately 65% of men experience sperm concentration dropping to severely low levels. Recovery is possible after stopping therapy, but it takes time and is not guaranteed to return to the original baseline. Imagine beginning therapy, feeling better than you have in years, and discovering 2 years later that the path back to fertility is longer and harder than anyone told you. That conversation belongs at the very beginning. Now let me also speak to something that rarely gets discussed: the psychological dimension of living with untreated hypogonadism. Men describe it in different ways. Some say their motivation simply evaporated. Others say they stopped caring about things that used to excite them. Some struggle to put words to it at all. They just know something shifted, that they feel older on the inside than their age should allow. Depression scores among men with clinically confirmed low testosterone are strikingly high. Low testosterone creates a biological environment that makes depression more likely, and depression suppresses the hormonal signaling that drives testosterone production. Research has shown that in men with confirmed hypogonadism and depression, testosterone therapy produced meaningful reductions in depressive symptoms, even in men already on antidepressant medication. These men are not weak, they are not failing at life. They are operating with a biochemical disadvantage that has a name, a mechanism, and a treatment. Additional side effects that are real but typically manageable include acne and oily skin, mild fluid retention, and in some men, breast tissue sensitivity caused by the conversion of testosterone to estradiol. Men genetically predisposed to male pattern baldness may notice accelerated hair thinning. None of these are life-threatening, but all are worth knowing and monitoring with your physician. I also want to pause here and talk about something that gets buried underneath all the clinical language: what it actually feels like when TRT works the way it should. Men describe a quality of clarity returning, a sharpness in thinking that they didn't realize they'd lost until it came back. They describe waking up with a sense of purpose that used to be automatic but had quietly disappeared over the years. They describe going back to the gym and actually seeing results for the first time in years, rather than grinding through workouts and wondering why nothing was changing. They describe conversations with their partners becoming warmer, more connected, more alive. These are not side effects of a medication. These are the signs of a man whose physiology is finally operating at the level his body was designed for. That is what this therapy, done correctly, monitored carefully, used in the right person for the right reasons, can restore. And that restoration matters, not just for the man himself, but for everyone in his life who benefits from his presence, his energy, and his engagement. Hormonal health does not exist in isolation. It radiates outward into every corner of a man's world when it is addressed with the seriousness and care it deserves. The change is not subtle. It is the kind of change that men look back on and describe as reclaiming a life they thought they had simply aged out of, and realizing they never had to accept that loss in the first place. The form of TRT you use also matters, and this decision deserves genuine discussion. Injectable testosterone produces predictable levels and is cost-effective, but carries a higher erythrocytosis risk due to hormone peaks after each injection. Gels offer more stable daily levels, but absorption varies between individuals, and skin transfer to a partner or child is a real concern. Oral testosterone is convenient and carries the lowest red blood cell impact, but requires twice daily dosing. Pellets offer the most stable, hands-off delivery, but cannot be easily adjusted between insertion appointments. There is no universally correct answer, only the answer that fits your biology, your lifestyle, and your risk profile, arrived at through an honest conversation with someone who has the expertise to guide you. So who genuinely belongs on TRT? Men with consistently low morning testosterone, confirmed on at least 2 separate blood tests, who are also experiencing real symptoms of hypogonadism. 2 readings, 2 mornings, real symptoms. That is the clinical picture. Men with active prostate cancer, uncontrolled sleep apnea, plans to father children, breast cancer, or severe uncontrolled heart failure should not be on TRT. And throughout all of it, before, during, and long after starting, monitoring is the non-negotiable foundation. Blood levels, red blood cell counts, PSA, symptom review. The men who benefit most from TRT long-term are not the ones chasing the highest dose. They are the ones who monitor carefully, adjust thoughtfully, and treat this as what it is: a serious medical intervention with real power to change lives. The right treatment, in the right hands, at the right time, that is medicine at its best. If today's video gave you clarity you didn't have before, language to bring into a conversation with your doctor, or simply the confidence that your questions are valid, please hit the like button right now. It helps Men's Vitality Hub reach more men who need honest answers. And if you haven't subscribed yet, join us. Every week we cover the things that actually determine how well you age. Your hormonal health is not a luxury. It is the foundation of everything. One last thing before I let you go. If there is a man in your life, a brother, a close friend, a father, who has been quietly struggling with fatigue, mood changes, or a loss of drive, and who has never had a real conversation about his hormonal health, please share this video with him. Sometimes the most powerful thing we can do for the people we love is simply hand them information at the right moment. The right information, at the right time, can genuinely change a life.